October is Pituitary Awareness Month. What does that mean, you might be asking? Well, Barrow Brain and Spine, it defines itself as a leading center for pituitary care. And here to educate you and share what they do if you are diagnosed is Barrow Brain and Spine nurse practitioner Deborah. She works alongside the neurosurgery team to treat patients with pituitary tumors. It's wonderful to see you.
Thank you for having me.
I was just asking you, before the show, what is a pituitary tumor and how common is that?
Sure. So the pituitary gland is actually a small gland there at the base of the brain. So it sits under the brain, underneath the nerves that control the vision.
It's a little tiny spot there.
It's tiny.
Yeah.
It's about the size of a chickpea.
Yeah, it's really tiny. What is the function of the pituitary gland?
So the pituitary gland, I describe it to patients as sort of command central. So all of the hormone functions in the body are mediated by sort of the marching orders that they get from the pituitary gland. So tumors in this region are fairly common. So about 10 to 20% of the population may have a spot in the pituitary gland. So it's one of the more common intracranial lesions that we
do. We know we have a pituitary tumor? Can you feel it? Are there symptoms associated with it?
Sure. So the symptoms are not always obvious, and they can be varied because the hormones impact so many functions of our body.
Sure.
So one of the things that I always recommend is that health maintenance. So making sure that you see your primary care provider, that yearly annual physical that we're not very good at making.
Right.
And just bringing any concerns to light, because then your provider can potentially identify an issue that may be related to a hormone either deficit or excess, and then can provide further testing. Another piece of that is your ophthalmologist, because of the area where that gland sits. When tumors grow there very large, they can press on the vision nerves and impact the vision. So getting your yearly eye exam, again, another way that you can stay on top of your health and ensure that if you have this problem, this diagnosis, it's caught early.
But you were saying that the symptoms are not necessarily associated with pain, so it's not like we're waking up going, oh, I have a headache, or I feel like I have blurred vision.
Sure.
So it's a little more difficult to diagnose.
Yeah, it can be tricky, and it can be based on both the size of the tumor or the type of the tumor. So because it's in the gland that produces hormones, sometimes it'll produce excess hormones and create problems in that.
Right.
Other times headaches can be associated if they get very large.
Can you die from having a pituitary tumor?
So they are generally benign, slow-growing lesions. So they're not something that we consider to be cancerous. However, they can certainly impact the quality of life, and if not caught and treated early, and that referral made to a center like Barrow Brain and Spine, where we treat and specialize in that, certainly it can impact the quality of your life.
So what is your role in treating patients?
Sure. So I am the boss. No, I'm just kidding.
I like that. She's boss.
No, my role is I'm a licensed independent practitioner. Okay. So I am a healthcare provider. I work alongside my collaborating physician, which is Dr. Andrew Little, who is a subspecialist in the neurosurgical treatment of pituitary tumors. So every week we have a multidisciplinary clinic where we see patients alongside our endocrinologist colleagues, which are the hormone doctors. And we help at that point diagnose and treat them. So you may see me in the initial consultation. If surgery is your plan of care, then you may see me in the preoperative, in the postoperative period, and during surgery.
Man, what a team. Is that what sets you guys apart? Really,
it's both that team approach and the fact that Barrow is, we are a world-class destination for neurosurgery. So when you come here, you can be assured that we've kind of seen it all. And even though this is a new diagnosis for you, this is something that we've treated and are very familiar with. So it helps patients have just confidence and assurance that we've really treated it all.
And do we need a referral quickly?
So oftentimes the primary care provider or the ophthalmologist will be the one that identifies this problem and then refers to us. So ultimately when you come to us, usually you've already had that MRI done, and then we order the labs and help clarify any misconceptions you may have had about your diagnosis, come up with a treatment plan specific for you, and then take care of you.
All right, so let's get you taken care of with the boss. Barrow Brain and Spine. They are located at 2910 North 3rd Avenue. That is in Phoenix. 602-406-8450 is the number to call to book your appointment today, or visit their website, barrowbrainandspine.com.